Clinical presentation, which is divided in three parts: early lesion, intermediate lesions, and then you have advanced lesions. So, how to remember it? First of all, now first we have study. In early lesions, what happened that the patient is asymptomatic. There is no symptoms, but there is a presence of white and red patch, exophytic growth, and small indolent ulcer is present. Means that growth is considered as an indolent ulcer. So how? So there was Arti girl who used to wear a very scarring sari. You can remember it by this. I know it's very horrific, you can remember it. There was a girl in first floor. The Aarti used to wear a very sanskari sari. Okay, so you can remember it by that. Okay, so it is asymptomatic, number one. Then basically you have a red or white patch. Then you have basically a small exophytic growth and small indolent ulcer is present. In intermediate lesions, you have persistent ulceration. Means that ulceration which was present early, now it is now continuously present. The induration means it is hard. Now it is further hardened. Now when there is an induration means it is harsh, means it is fixed to the underlying structures. Means this is fixed to the underlying structures. And there is lymph nodes enlargement. Means in the second stage here, the lymph node enlargement is present in squamous cell carcinoma when any patient stage to the intermediate stage type, or lesion when intermediate. So there is an lymph node enlargement, but this may be non-specific. Okay, very important. Now this is you can see right white patch like ulcer it looks, and secondly it is a induration is present basically, and it is when it persists for more than 2 weeks. Okay, now advanced lesion, very important. Hemorrhage or necrosis of exophytic mass, that mass which was appear in the early stage, and that ulceration was persistent. Now in that persistent mass, what happened? There is a necrosis and hemorrhage. Okay, crater like ulcer with the raised rolled edges is present. We know it. Pain and paresthesia, there is pain in that area. Means in early what we have studied there was no pain, but now in advanced lesion now there is a pain. Bone destruction, invasive fractures. Now there is a bone destruction because it was fixed to the underlying structure. Now it is moving deep. Mobility of teeth, the patient will have in a mobility of teeth in advanced lesion, very important point. Okay, so now repeat with me that in early lesions what happened, there is asymptomatic small exophytic growth, red white patch is present, and then you have also a small indolent ulcer. Then that ulcer in the intermediate lesion, when it becomes it, the ulceration persists. Now there is a new thing happening is that now it become indurated more hard. Now it is fixed to the underlying structures. Okay, now there is a lymph node enlargement is also present, but in advance what happened, and that mass is there is a hemorrhage and necrosis occur, and the ulcer is like a catheter with a rolled or raised edges. In that specific area the patient feels pain and paresthesia, and due to the fixed to the underlying structures, now it is cause destruction in and fractures, and now there is a mobility of teeth also. There is a three levels, or you can say histopathological levels: well differentiated, moderately differentiated, and poorly differentiated.